The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to Aging Horizons. On today's show, we'll be talking about suicide in Montana. We are usually in the top 5 in the nation every year for suicides. So let's talk about resources that are available to the individual, to the family members who might see possible indications that somebody might be considering suicide. And we'll be talking about what the state is doing to assist. So stay tuned.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
Is that Robert Knievel? Captain Lewis, Captain Clark, I'm officially Evel Knievel now. I'm getting my Montana Real ID.
Did you make an appointment at mtrealid.gov?
Yes, sir.
Smile.
I brought my non-laminated Social Security card, 2 documents proving my current residential address, and my certified birth certificate.
Approved.
Go to mtrealid.gov.
Now I can fly. It's that easy.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. As we were discussing earlier, Montana rates in the top 5 in the nation every year for suicide. So Montana's legislature has employees dedicated to the issue of suicide in Montana to help define it and hopefully solve and save a number of lives. And that person is with us today. We have Carl Roston. You're the Suicide Prevention Coordinator. Welcome to the show.
Thank you very much, Brian.
Back to the show.
Yeah, glad to be here.
Great. Well, let's start at the top. Let's define the problem. What is the current state of suicide in Montana?
Sure, and we've been in the top 5 for the last 40 years. But even if you go back 100 years when we started keeping statistics, Montana's been near the top for more than 100 years. Each year we have a rate approximately double the national rate of suicide. That equates out to being about 300 people each year we lose to suicide.
Yeah. Wow, that's amazing. Is there a breakdown as to age groups? Is there predominantly one group that prone to this?
Nationally and in Montana, it tends to be middle-aged men. And in Montana, though, the sad thing is it's a little bit younger. It starts about 25 to 45, where the national is about 35 to 55. Mm-hmm. So we are losing younger folks to suicide.
Yeah, so the Montana legislature this last time around, they passed a certain number of laws in which involve you as a suicide prevention coordinator. What are some of those, and how does those changes help address the issues of suicide?
Well, part of it was for us to have some additional staff. One that works a lot with our tribes and our reservations, and then another one was to give me a program manager that manages some of the grants, works with our crisis resources, and also works with our veteran population.
Now, you mentioned crisis resources. What are some of those resources? If somebody's considering suicide, many times they might not know those resources are there.
Yeah, we have for years we've been part of the National Suicide Prevention Lifeline, and that's a 800-273-TALK, which is the National Suicide Prevention Lifeline. But when you call that from Montana, about 93% of the time it stays in state. We have 3 call centers in our state that handle those calls. So when people call that, they are talking, the majority of the time, are talking to somebody in Montana. That is about to change. Nationally, they're moving to a 988 number. So it's a 3-digit number. Hopefully it'll be much easier to access and remember. That's officially going to kick in next July of 2022. However, some of the wireless services are already using the 988 and patching it through to the Lifeline. So that's going to increase our capacity for calls, for sure.
Well, I mentioned suicide has been studied a lot, and I imagine it's a last step for some individuals, but I remember in our prior conversations you said suicide is a permanent solution to a temporary problem.
Right.
And the people need to understand that the majority of those are temporary problems, right?
Absolutely. And we also often say that suicide occurs when the pain exceeds the ability to cope. And we often see that people are dealing with stressors, like whether it's mental health issues, substance abuse, maybe it's financial, relationship. And often they struggle with being able to manage it, and suicide becomes a viable solution to ending it. And that's something that we really want to start to challenge, because most of these problems that people are experiencing are temporary. And if we can just get through that crisis period and get them through that, then often, most of the time, people don't change their mind and they don't want to die. So, and we know that because one of the stats that we often talk about, 90%, 9 out of 10 people who attempt suicide and live will not go on to die by suicide. And so that really tells us that when people make an attempt, they're thankful that it didn't result in death.
Right, yeah. And imagine the individuals think that's a solution for them, but maybe they don't realize what happens to all their family members and loved ones around them.
Yeah, it's interesting though, because a person who is severely depressed and suicidal often think that they're actually hurting their loved ones, that they're a burden, that they're holding them back, maybe financially or causing them pain. And so they often think that they're actually doing their families a favor. And that's part of the cognitive distortion of depression, is that you think you're all alone, no one cares about you, you'd be better off dead.
And of course, that's wrong. Like you said, they regret doing that, the majority that survive. So how do we start addressing the issue of suicide in individuals? How do we inform those individuals that there's alternatives?
Well, I think we have to start to challenge the stigma. There's a huge stigma when it comes to depression and suicide, and especially in the Rocky Mountain region. But we have to start to make it okay for people to be able to talk about it. People need to know it's okay that if they have depression, that there is help available, and that it's not a sign of a weakness or that they're broken. And that perception often stops people from asking for help. And that's one of the things we really have to challenge.
So we have the individual that needs to ask for help and to challenge that, but how about the loved ones noticing something going on with a loved one?
Right.
How do they broach that topic?
Yeah, definitely. We really want to encourage people to raise their awareness about what are the warning signs to look for in someone that may be at risk, and then what are the things that they can do. And we could definitely talk about that. I definitely want to talk about that. But raising that awareness, and it's not just with loved ones, but we have to work with our primary care providers, our law enforcement, because they're all often in positions where they come into contact with people that are at high risk.
And I know whenever I talk to a medical professional in an appointment, one of the questions is, are you contemplating suicide?
Good.
So there's a lot of push out there on that.
Absolutely. It's one of our major focuses is with primary care.
Primary care. And as we mentioned, we'll be talking about the warning signs in our next segment. And, we mentioned that Montana is the top 5, usually in the top 5 in the nation, states for successful suicides. And we want to start to address that. We do have some programs, we have resources, we have individuals like Carl that is out there, and it's accessible to your organizations too. If you'd like them to come in, I know we'll have a number on the screen. You can give them a call. You'd like a presentation, Carl and his group would love to talk to you. So we got a lot of great information, so stay tuned. This is a real important topic.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about suicide in Montana. Rejoining us is Carl Roston. And Carl, what are some of the reasons or factors that people are driven to suicide in Montana?
Well, a lot of people, it's not just Montana, it's our region. It's the Rocky Mountain region. If you take a look at the top 10 states, just about every one of them are in the Rocky Mountain region. And the important thing is that it's not one factor. There are multiple factors that contribute to the issue of suicide. And in the Rocky Mountain region, we have a perfect storm as far as all those factors happening at the same time. We have a lot of northern states where sunshine is a factor. And of course, we get vitamin D from sunshine. Vitamin D deficiencies are correlated with an increased risk for depression. We have high alcohol use, major issues in Montana. Nationally, about 20-25% of the people that die by suicide have alcohol in their system. Montana, it's about 43%. We have access to lethal means. We live in a gun culture. That's people own guns, and Montana's in the top 3 for gun ownership, and so that's a factor. The bigger ones, social isolation. We have about 6 people per square mile. National average is about 88 per square mile, which then that affects our ability to get to help, but also crisis response. We have socioeconomic. We have issues such as lack of behavioral health. We don't have enough psychiatrists. We don't have enough behavioral health folks. Altitude. I mean, and this, of course, is an issue worldwide, but at about 2,500 feet worldwide, you see a spike in suicides, and it has to do with metabolic stress caused by long-term oxygen deprivation. But along all those states, right down the Continental Divide, are all these states. So there's a number of factors that really contribute, and it's all of them happening at the same time.
And it's a generalization. The majority of them are male?
Yes. In Montana, about 80% of the suicides are by men. But that's primarily because men tend toward more violent means. Women tend to overdose, which is very low as far as the percentage that result in death, about 3 to 11%. But if you use a firearm, it's 93%. Men tend toward more violent means.
Violent means. Well, that's a fascinating aspect about the nation and Montana and the western states, where I'm going to make a generalization. We pride our independence and not really being. We don't express our emotions, so we tough it out.
We have that cowboy up mentality, and that's a major factor in the Rocky Mountain region. I mean, we don't like to talk about our problems. We have a sense of independence. We take care of our own. And when it comes to issues like depression, anxiety, we see ourselves as a burden, and we think we're weak. And that is a major factor that we really want to counter.
And I think part of that might be because we're probably hesitant to ask for help from healthcare providers. I mean, you tell someone you're seeing a psychiatrist, social worker, or something else, there's stigma right there.
Right, absolutely.
And we're hesitant to talk to them, but we shouldn't be.
No, and what we do know is that 45% of all the people that die by suicide in the nation saw their primary care provider within a month of dying. And that's especially alarming because we know a majority of the people that die by suicide gave warning signs. And so our primary care has really become a focus. And although we don't have enough behavioral health, we do have primary care. We have nurses, we have doctors, we have PAs. And so one of our major focuses is training healthcare providers in how to do risk assessments and what we call safety planning and suicide-safe care for patients.
And, you know, we're talking about the health professionals being aware of those signs. I think that the lay people like us with our loved ones, we should be aware.
Absolutely.
What are some of the major warning signs that we might notice in others, much less ourselves?
Sure, and what we're really looking for is a change in character. They're not acting like themselves. They start to communicate an intention of dying, or that they're, everybody would be better off if I wasn't around. There's often a change in substance use. They start to use when they didn't before, or they start to use more and more. They start to withdraw. They start to pull away. They start to exhibit more irritability or anger. They start to they pull away from relationships. They quit their jobs. All of these are starting to be warning signs for people to look for. When you see them, and this is the important piece that we want to get across to the general community, is that when you see them, talk to them. Ask the question. A lot of people are afraid to ask the question, are you suicidal? Because they think they're going to put the idea in the person's head. Not 1 ounce of research to support that. On the contrary, asking somebody if they're suicidal validates their pain. It opens up communication. It gives them an opportunity to get help. So asking somebody if they're suicidal is what we need to do. Validate or persuade them, say, hey, I don't want this to happen, let's go get some help, I'll go with you. And then the important piece is then take them directly to help. And that looks different, depends on where you are in Montana, but ideally you take them to your nearest hospital or ER. You can, if you live in a small rural community where they maybe don't have a hospital, call 911. Or the Lifeline even, because the Lifeline's tied into the 911 system. But they can call and then you just stay with the person until help arrives. We train all of our law enforcement in the state in how to do risk assessments and suicide prevention. So if you don't have a primary care, we have law enforcement, we have the crisis numbers.
Okay, and I the first thing you mentioned is people maybe commenting about suicide. Many times we take that as a joke, or they kind of throw it out as a joke, but listen to them.
Right, that's part of the stigma, is that they're throwing it out just to see how people respond. And if someone laughs about it and says, yeah, you'd never do that, then that tells them that it's not okay to talk about it.
Yeah.
Take those serious. People don't joke about suicide. It's a way of getting a feel for their audience to see if anybody actually cares or how it's going to be seen.
Well, that's very interesting.
Yeah.
That's amazing. Well, we're drawing to a close on our second segment. We got a lot of more great information, but listen to what the people are saying. Get resources, help them, and maybe educate yourself as to what is available in your community, what resources are there, and kind of look around. See your friends and family. Are they having major changes in their life, as Carl has mentioned? Is there major shifts? Are they giving things away? Are they talking about suicide? We'll continue our discussion about this important topic in just a moment. Stay tuned.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline, Montana.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away. and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about suicide. Again, we're usually in the top 5 in the nation every year for suicide, and we want to address that issue. And we're here with Carl Rustin, the Suicide Prevention Coordinator with DPHHS, and there must be some programs out there that are available to educate people and bring resources to the community, right?
Yes, definitely. And it's important when we talk about interventions for suicide, you can't just focus on one age group. I mean, it really takes a multi-tiered approach. This is a cultural issue. I mean, we've been high for suicide for 100 years. It's going to take a cultural shift in thinking, and that's going to take time. We're not going to address this issue overnight. It's going to take sometimes 10. Some of the programs we're using now, we're thinking are going to take effect 10 or 15 years from now, or even longer. So we work a lot with our schools, of course. We have a great program that is actually for first and second graders, and it's called the PACS Good Behavior Game, and it teaches kids coping and resiliency skills. And the research has shown that it's effective 30 years later. And it's not even just suicide prevention, it's actually substance abuse, criminal behavior. It's a whole pro-social thing. So giving kids the tools at an early age can actually help when they enter into their high-risk groups, when they're in 20, 25 years old. We have a program called SOS, Signs of Suicide. This is for middle school and high schools that teach kids warning signs and how to intervene. We have a great program called YAM, Youth Aware of Mental Health, that teaches high school students resiliency skills. I mentioned the primary care piece. That is really essential, because if you take a look at the literature reviews as far as what actually has been shown to work with suicide, training primary care providers is essential. And there's an initiative called Zero Suicide, which comes out of the Henry Ford Clinic in Detroit. But it really advocates for universal screening for depression with all patients, and then a systematic of tools to use, a suicide risk assessment, something what we call safety planning, lethal means counseling, follow-up contact. When that sequence is followed with patients, a dramatic decrease in subsequent suicidal behavior. Training our law enforcement and first responders. 90% of the suicide calls are the first responders, and law enforcement are the first ones on the scene. So giving them the tools to recognize the signs. We have a program called Crisis Intervention Training with law enforcement that trains officers when they arrive at a scene to be able to quickly assess whether they're dealing with a mental health issue, domestic violence, sexual assault. We have a program called QPR, which is for everybody. And it's a universal gatekeeper training that raises awareness about the warning signs and what to say to someone. So training our firefighters, our first responders, the EMTs, police is critical. So we have programs where we work with HR directors in companies and Department of Labor around training employees in awareness, training HR folks to be able to recognize and do a quick assessment. There's quick assessment tools that we have available to identify. But it really has to be addressed from all aspects. We can't just focus on one part. This is a multi-tiered approach that has to be taken.
Yeah, multi-tiered and long-term.
Absolutely.
I love that.
Yeah.
But you're getting, I'll say, people's skills outside suicide, too, because of suicide issues, and that'll help them the rest of their lives. That's fascinating.
Yeah.
But now, is this training accessible if somebody wanted to give you a call?
Absolutely.
I mean, they have a public group they'd like you to talk to or someone.
Yeah.
They could just give you a call, right?
Absolutely. And we have, depends on the type. I mentioned the QPR. We have probably about 80 to 100 QPR trainers in the state. There's one called Assist that's a little longer. It's a 2-day training, but it's very thorough. We have those. We are really pushing out the primary care piece, and so I currently train in just about all the colleges of nursing in the state, so that they have the skills before they go into the work field. But we also train at hospitals, and we're actually in the next month going to be doing a train the trainer, so that we can provide, so we'll have at least 40 more trainers that focus specifically with healthcare providers around the state, so that we can cover the state with resources.
Great. Well, now we've been talking about suicide, and we got a big population that are independent. They're on their own. But what about children? They're supervised by their parents. They're probably living with their parents. What are some of the things you'd want parents to maybe look out for in their children?
Parents, 86% of parents that lost a child to suicide didn't even know their kid was depressed. Because as parents, we lose our objectivity. Yeah. It's hard for us to picture our child wanting to die. Yeah. So we really need parents to take a look at that, recognize the mental health side of things. If their child is experiencing depression or anxiety, the one trait or warning sign that is different with kids than adults is impulsivity. Kids tend to be impulsive; they do things without thinking. And I really, if parents, the biggest thing I want parents to do is, if they recognize that their kid is struggling in any way, I mean depression, anxiety. Make sure that their home is safe, meaning they lock up medications. They make sure that any firearms are safely stored while their child is going through this. Because you add impulsivity with immediate access to a firearm, you have a suicide. And it happens very quickly. Yeah. And so really want parents to be aware of mental health issues and make sure that their homes are safe. Homes are safe, and we're quickly drawing to a close on the show. Are there some final statements you'd like to say to our viewers about suicide? The biggest thing is, let's talk about it. It's not taboo to talk about it. We need to get people's awareness up. We need people to know that this is an issue that is preventable. Suicide is the most preventable form of death. But we have to recognize the early signs. We have to recognize the depression, the anxiety. Talk to your doctor. Get your kids or your loved ones screened, because care is available. Mm-hmm. And it's seldom a crime, not a crime, but an action of impulsivity, unless it's a child. Yes. So keep an eye out. Keep an eye out. Well, thank you, Carl, for coming on the show. We appreciate this, and for all your work and for your service to all Montanans. Thanks for having me. Great. And again, for a viewer, we're talking about suicide and how we can prevent it. We talked about some warning signs. If you'd like to be better educated, or if you have an organization that would like a presentation on it, Carl has the resources and wants to talk to you. But you need to be aware too. Keep aware of your loved ones around you. If you're contemplating suicide, we do have resources that are there for you. And as we mentioned earlier, suicide is a permanent solution to a temporary problem. Please get help if you need it. Thanks for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.